Good evening and welcome to the WDSU News Hot Seat. I'm Travers Mackel. Tonight we are talking about the coronavirus, the epidemic that's gripping the world right now, and it's also affecting different states right here in the United States. To talk about this, we have two well-known doctors, Dr. Joe Kantor from the Louisiana State Department of Health and Dr. Jennifer Avegno from the city of New Orleans. First off, thank you all for being here.
Thank you.
Let's just start with you, Dr. Kantor. The state of Louisiana, how are you all preparing for this? Because it seems like all 50 states around the country are taking as many precautions as they possibly can.
It's absolutely right. We base our plans on what we do every year to get ready for flu season. At the beginning of every flu season, we plan for what would happen if this year we have a pandemic flu. Think about the H1N1 a few years back. And we make plans, and what we're doing now is very similar to that work because the virus is a respiratory virus and there's a lot of similarities. So we go through the worst case scenario book. What happens if we have some community spread in Louisiana? What happens if that grows a little bit? Who do we need to reach out to? What measures do we have to take? We hope we never have to implement these plans, but there's a lot of work and a lot of discussion that goes into make sure that they are robust.
You all work with the city of New Orleans. Dr. Avegno, the city of New Orleans is a huge tourism city right now. People coming in to Armstrong International and on cruise ships. What are you all doing to make sure residents here are safe?
Absolutely. And really the world is global, and that's why I think you're seeing the spread of the virus from China into a lot of other places. So when this first began to come into the consciousness, we work very closely with the Louisiana Department of Health. Our plans are in large part based on their plans. Again, we also have plans from things like Zika and Ebola several years ago, and then our regular flu plan that we looked at, are revising and collaborating. Before Mardi Gras, we had a series of meetings with the airport, the port, Coast Guard, tourism industry, as well as healthcare systems and hospitals in the area to make sure that everybody's plans were up to date. And we worked through some scenarios, as Dr. Kantor said, sort of a what-if scenario. So we feel that everybody is prepared as we can be.
So let's start with you, Dr. Avegno, on this question, then we'll go with Dr. Kantor. If somebody does contract the coronavirus here in Louisiana, there are no known cases right now in Louisiana. How do you calm fears for people? Because it seems like every state it's popping up in, people start to get really scared of, oh my God, what can happen? How do you calm fears if in fact we do get a case here in Louisiana?
So first of all, right now, the vast majority of cases, we have a known source. It's a contact or someone who traveled to an endemic region. What we're watching and waiting is those cases, as you said, that may or may not pop up in the community. The first thing to remember is that, as Dr. Kantor said, the coronavirus is a respiratory virus very much like the flu. While we don't know everything about it, we do know a lot about coronavirus and respiratory viruses in general. And so prevention and practicing good hygiene and all that is the key. We have a really robust state program, the state ID EPI program, that if there is a case of coronavirus, is going to be the first one to be in contact with things like with individuals or programs like the CDC to help give us the proper guidance. I'll let Dr. Kantor speak a little bit more to that, but that's going to help us make decisions going forward about what to do in the event of a case.
And then let's just say we do have a case. We hope we don't in Louisiana, but if we do, how do you work to calm fears and how do you work to isolate the person who could be a patient of coronavirus?
Sure. I think it starts, Travers, with transparency. And, the responsibility is on our departments to be forthcoming and transparent with the public, and that's what we've committed to do. It depends a lot about what this case is and how and where they contract it. We do have some travelers coming back, and they get filtered right now through one of 11 airports nationwide. MSY is not one of those airports. And they get screened there by CDC and Customs and Border Patrol. And cases get picked up that way. So if we pick up a case that way of an individual who is not that sick and is fit to be isolated at home for 14 days, for example, that's not a very big deal. It's much different if a case pops up like we saw in California a couple of days ago, where there actually is no known contact.
Right.
That might be the forthcoming of some community spread. Very different cases. But we start by being as transparent and forthcoming with the public about that as possible.
How long do you expect this to stick around? You all both mentioned H1N1, Zika. There have been other cases in the medical field that have popped up like this. How long do you think coronavirus is going to stick around? Are we at the beginning or are we at the end of something like this when it compares to other countries around the world and other incidents like H1N1 and Zika?
I think it's difficult to predict, particularly since there is such a global spread. There's close to 50, if not more, countries right now. Each country has its own individual response, so it's very dependent on that individual country and how that limits the spread. I think we are probably at the beginning, but I think it's really hard to predict how long it's going to hang around.
How do you feel about that, Dr. Cantor? Are we at the beginning or at the end, or is it tough to tell right now when it comes to a virus like this?
It's tough to tell when you're in the middle of it. I think we're probably in the beginning stages, as Dr. Avegno mentioned. You know, one of the things about these respiratory viruses is they tend to go down a little bit during the summertime. You see that with the flu every year. So the NIH has kind of prompted us that we should expect to see the case counts go down a little bit, at least in the Northern Hemisphere, as summer rolls around. The question will be whether that pops back up in the winter.
For people watching this right now out there, they're all interested, and we get a lot of emails and text messages and social media here at the station of, what do I have to do to prevent it? Is it just simply washing my hands and good hygiene? Is that basically all people can do right now, or can they do anything else? We'll start with, go ahead, Dr. Avegno, we'll start with you.
Sure, that is what people can do. That's true no matter what the respiratory virus is. Washing your hands, staying home if you're sick is critical. And we're asking individuals who are feeling ill for whatever reason, stay home. And we're also asking businesses to understand. We are still in the peak of a very serious flu season. So the same rules that apply there would apply to any other respiratory virus like coronavirus. Washing your hands, coughing into your elbow, trying to stay out of large public gatherings or areas, or being in close contact with people if you are ill.
Is that the same, Dr. Cantor? Is it basically just common sense practices can help you prevent the contraction of coronavirus?
Of all viruses, really. We're talking about cough etiquette, so covering your mouth when you cough, frequent hand washing, much more than you're doing now, I promise you. And really trying to avoid touching your face and eyes, which is a lot harder to do than folks think it is. You know, our teams at the state and the city health department are working literally around the clock to review plans and update, and are thinking through worst case scenarios. I want them to do that, and I want the public not to overreact right now. There are no cases in Louisiana at the moment. It's Friday morning now. We don't even have any suspected cases in Louisiana. We will communicate that should that change. I think folks should go about their daily lives, practice good hand hygiene, and if they haven't gotten the flu shot yet, there's still time to do so this season.
What about people, I know we talk about this, we have small children. What about people who have small children or take care of the elderly? Because obviously, I guess if you're younger or older, it can hit you harder. What should they do if somebody has a small child or if they're a caretaker for somebody who is elderly? Same
Precautions. You know, we know that elderly people in China and some other countries that are being hit by the virus right now are doing worse. Strangely, young people seem to be doing fairly well, and we don't really have a good explanation yet, so we're watching that closely. But there are no special precautions. Extremes of age always are concerns for any type of illness. You know, as Dr. Avegno mentioned, we're still in the middle of a flu season. There's still time to get the flu vaccine. People forget how deadly and costly the flu is year in and year out. So last year in Louisiana, 15,000 people were hospitalized, and 1,550 people died from the flu, and it wasn't even a bad year. So to put it in perspective, I think that's where some of the efforts need to be spent. If you could talk about this too, Doctor, in the city of New Orleans, we have French Quarter Fest coming up, we have Jazz Fest coming up, we have St. Patrick's Day coming up, which is a huge event here in the city of New Orleans. Is it concerning with all of those big events where people will be gathered in the tens of thousands in these crowds that something could happen?
So again, this is a fluid situation. Right now, we are not anticipating having any changes to any of the festivals or any big, large public events. But as Dr. Cantor says, we are going to take our guidance from the CDC and from the State Health Department in terms of what the CDC is calling social distancing. Right now, that's not something that anybody is recommending. However, the big public gatherings can spread other respiratory viruses. So again, if you're sick, don't go to the St. Patrick's Day parade. There'll be another one next year. If you feel like you are not up to speed, this is not the year for you to go out. And again, if you do want to take advantage of all of our outside cultural activities, get a flu shot. Make sure you're protected before you're going out into the public.
So the jail on Friday, the jail told us, OJC, Orleans Justice Center, told us that they're taking all precautions because this is an interesting development. We're such an international city. We have so many people that come here for Mardi Gras events, cruise ships, and some of those people do get arrested in the city of New Orleans. If they bring them into a holding tank, could they contaminate the entire facility? They're doing everything they can to make sure that doesn't happen. Is that a step in the right direction that needs to be done?
Absolutely. And it's something that facilities like jails or even shelters, nursing homes, retirement homes, people congregate in close situations, go through every year because they always have people that have the flu. Sometimes we're dealing with other infectious diseases. So I'm confident they can base these plans on what they've always done in situations like this. But I'm glad that they're talking about it, and I think every facility should be mentally going through their worst case scenario plans.
If you could talk about that too, is it good jails, especially OJC, in these places that may have people come in for a night and leave? They want to make sure everybody doesn't get affected. Is that a step in the right direction for them?
Oh, absolutely. Any facility where folks congregate in close quarters. So a jail is one of them, but that, think of the cruise ship, right? The cases of the coronavirus on the Diamond Princess cruise ship were not because of anything special about a cruise ship, but it was because folks were in close proximity. So every institution that houses folks, this is why we see outbreaks of things like mumps and measles on college campuses, because it's where people are living in close quarters and where viruses like the coronavirus or flu or others spread rapidly. So any institution like this should already have a plan and should just be making sure that they can apply it to coronavirus if that occurs.
Really quickly before we let you go, you're not Wall Street whizzes or financial experts. You're medical professionals and very good ones at that. But Wall Street has taken a hit. Most officials say, and most financial experts say, hey, look, it's a blip on the radar screen. This happens when we have situations like this. Is that your understanding? And like I said, I know that that's not your field of finance, but you've seen this before. Does it seem like sound advice that it just seems like this could be a hiccup in the market given what's going on with the coronavirus?
Well, limited understanding of the market, but the market was due for a correction in any case, is what most of the experts say, and the coronavirus, I think, provided the mechanism for that. Certainly, it does seem like China in particular is going to have a real economic effect because of the slowdown in production and trade because of the quarantine measures that they've taken. Predicting beyond that, I think, is very challenging.
How do you feel about that, Dr. Kenter? I know it's asking you a financial question when you're a medical expert.
Look, my wife and I are not making any changes to our retirement fund right now. Despite the politics that have been swirling around this, there are some honest-to-God experts at the CDC, at the NIH, and at the state and city health department who are really good at what they do, committed public servants, and I have a lot of trust that the country will do what is needed for this.
All right. Dr. Joe Kantor, Dr. Jennifer Avegno, we appreciate your time about this very serious issue that's affecting the world as well as the country and possibly even Louisiana in the future.